So I keep talking about how sick that I was last week, right? But that's because when you're sick, you just want a goddamn one pill to fix everything. And this might be causing us to go crazy with the antibiotics that are available today. A study published by JAMA Network this past Monday found that patients rated themselves happiest with their doctor's visits when they got an antibiotic after seeking care for a respiratory tract infection, such as a common cold, whether they needed the drug or not. We all know when patients come into the ED, when patients do their, they call the primary care, I need to see you right now, I'm sick, my kid is sick, my mom is sick, whoever is sick. They go to the doctor's office, they go to the hospital, and they want to leave with something. They're sick. They're not going to go over there for you to tell them to drink some water, drink some Pedialyte, Gatorade, rest up. And they don't want to hear that shit. They want a pill that's going to fix their problems. And even if it doesn't fix their problems, knowing that they have something to take will just make them feel better. And that's probably the reason. Because last week, I would have done anything, goddamn anything, to get a pill that would have fixed my problems, right? Sometimes you got to fight that shit out. But these patients, myself included, as a nurse, don't want to hear it when they're feeling really shitty, or a family member of them is feeling really shitty. The research that analyzed over 8,000 appointments for with these specific infections, the common cold and the respiratory tract infections, and they found that physicians in the study prescribed antibiotics for respiratory tract infections at about twice the rate that would be clinically appropriate based on current research. And this is the kicker, all right? This is the problem. No other factor was as strongly associated with patient satisfaction as whether they received a prescription for an antibiotic, which is mind-blowing to me, right? So we all know that we have, pill seekers that go because they want some narcotics, but that's a whole different story. According to this study, was no other factor that influenced the satisfaction of the patient more than if they received an antibiotic when they went in with those symptoms, which is crazy, right? And the reason that this is a problem, if that was a problem, if patients were just mad because they weren't getting the meds they wanted, that wouldn't be the issue. The actual issue is the doctors are prescribing it. The reason the doctors are prescribing it is because healthcare is now a consumer sport. You go down to when you're looking for a new primary care, if you're looking to go to the doctor or whatever, you look at it, it's basically a Yelp for doctors, and they all have ratings. So if this doctor stops giving antibiotics to all his patients and tell them to their face, you need to go home, drink water, rest up, and that's what's going to make you feel better. There is no medications that are going to make you feel better. They're going to leave pissed off. They're going to rate them really shitty. And if that doctor is rated really shitty, he ain't going to get no more patients. Because the Yelp for doctors is going to say he's a 1-star. And the 1-star is only because he's telling the patients what to do. This is a crazy cycle. And that's the reason I wanted to bring this up. According to Dr. Catherine Martinez, she's an internal medicine researcher at Cleveland Clinic, she said this is super, super concerning. She was quoted by saying, if we keep over-prescribing these antibiotics, they will be completely ineffective, and the consequences of this are huge. And that's the problem, right? Because we've all been taught this in nursing school, and all you healthcare providers know that we can't be over-prescribing these antibiotics because these bacteria are going to become resistant to the antibiotics, and then these antibiotics are going to be useless, right? They're just not going to work for anything. So this is a PSA to all of you patients out there, to all of you healthcare providers out there. I know that it's difficult. I know for you doctors specifically, but nurses, this is where we come in and help because we can do the hardcore teaching, the education, right? I know, first of all, let me speak to the patients out there. For the patients out there, understand the reason you're not getting prescribed the antibiotics that you want is because it's useless. You taking the antibiotic, you're not taking the antibiotic for a common cold or a virus, the antibiotic is not going to work. It's not going to affect you. In fact, it's only going to do worse things for you because the next time you actually need the antibiotic, the bacteria is going to be resistant to it. That's number one. Number two, for you nurses out there, this is where we step in and we really can help these doctors. This is where our education can make a difference, right? These doctors have 12, 40, 50 patients that they need to take care of. We get that chance to sit down with the patient and explain why the doctor did what the doctor did, why the patient's going home with this medication, or why the patient is not getting any medication. So this is where we go in, we sit down, and we tell the patient, you don't need this bacteria. And just like what I told the patients earlier, it's super important that we do this education, because if these patients continue to rate these doctors as horrible doctors because they won't give me my antibiotics, they're just going to continue to prescribe it, because these doctors need patients to make a living, right? They need these patients to make a living. Yes, at the end of the day, you doctors out there, the responsibility is on you. You can't be deciding on how you prescribe medication because of the satisfaction report from the patient. And I don't think the doctors I've dealt with, the doctors I've seen, I don't think that this is their first reason for doing it. Sometimes I think they just have a million patients, and if the patient's like, I need it, they're like, whatever, it's an antibiotic, it's not going to kill you, go. Leave me alone. I need to go take care of my 1 million other things. But that can't be the situation. We got to stop this. This is not just helping that specific person. This is helping the US of A, the world at large. We need to stop prescribing antibiotics as a whole, as all of healthcare. Thank you guys so much for watching. I really do appreciate this. If you guys were informed or educated in any way, shape, or form by these stories, please hit that like button. If you liked my presentation of the news, I really suggest you subscribe and hit the notification bell so you know every time Q the Nurse drops some hot, fresh press news. Thank you. Catch you next week. Deuces.